Hello there everyone, it's Ryan Liberty, and in this video I'm going to answer the question, what are bipolar and related disorders? Ooh, Okay, let's get into what bipolar and related disorders are, but just before I do get into that, there's one thing that I need to say. That is that this is not the diagnostic criteria for bipolar and related disorders. This is just descriptions of these disorders, so do not use this to diagnose anybody. In any way, you'd have to see a licensed professional who would be trained to be able to do that for you, so these are just descriptions. If the label of any of these disorders, for example, cyclothymic disorder, if that bothers you in any way, you don't have to use the label. The label's just there to point you to something that would be going on. So if it doesn't help you to heal, if it hurts you in any way, don't use the label. That's perfectly fine. So with that said, what are the bipolar and related disorders? So they involve three different states, three mood states, and you have manic episodes, hypomanic episodes, and major depressive episodes. I'm just referencing notes below to make sure I get everything right here. They don't always have all three of these, but you'll feature usually one or two of these at a time. So you have manic episodes. Those are expansive, elevated, or irritable moods. And during those times, there's increased energy and there's much more goal-directed activity, and that lasts for at least a week. Hypomanic episodes are the same thing as a manic episode, it's just that they last for 4 consecutive days or more. So if it's a week or more, you got a manic episode. If it's 4 days or more, you have a hypomanic episode. If it's less than 4 days, you don't have either one. Then you have major depressive episodes, and those are depressed moods with loss of interest in activity or less pleasure around activity, thoughts of death, feelings of fatigue, lots of different things when we're talking about a major depressive episode, but those last for 2 weeks, at least a 2-week period. So any of those three, hypomanic, manic, or major depressive episodes will be featured in these disorders. So let's get into what these actual bipolar and related disorders are. So you have bipolar 1 disorder, and that is a manic, hypomanic, or major depressive episodes featured thing. It requires the manic episodes, but all three of those can be seen in bipolar 1 disorder. Bipolar 2 disorder does not have manic episodes, however, it does feature hypomanic and major depressive episodes. And with bipolar 1 and bipolar 2, there's like a switching between these episodes. And then you have cyclothymic disorder, in which case the hypomanic and depressive symptoms, they don't meet the full criteria for a hypomanic episode or for a major depressive episode, but there is something going on, and it is a cycling between the two states. Then you have substance and medication-induced bipolar related disorder, which is when any of these states, this pattern of going between the two poles, bipolar, of mania and depression, they're brought on by medication. Then you have bipolar and related disorder due to another medical condition, which is due to a medical condition. Then you have other specified bipolar and related disorder, and that's when what's going on doesn't meet the full criteria for those disorders. So examples of that might be short duration hypomanic episodes and major depressive episodes, hypomanic episodes with insufficient symptoms and major depressive episodes, hypomanic episode without prior major depressive episode, or short duration cyclothymia less than 24 months. And then finally, you have an unspecified bipolar and related disorder, and that's something that would be used in an emergency situation, such as in a hospital, when they just don't have enough information to properly assess you. So they just kind of write you a quick unspecified bipolar and related disorder because that's what they're leaning towards. So that's the grouping of what the bipolar and related disorders are. I hope that that's given you a nice, well-rounded perspective on them, and it gives you a little peek into the human side of things. If you've experienced any of these, I'd love to hear what your thoughts are on them, so please leave a comment below, and I thank you for taking the time to learn about them with me today. Hey, it's Ryan Liberty. If you liked that video, please give it a thumbs up, share with a friend, and leave any questions or comments down below because that would really help me out. If you're somebody who's gone through a traumatic event and you're feeling cut off from the people around you, I have a free course that will help with that, so please click to get it. And if you'd like to see the rest of my videos, please click subscribe. As always, I want to remind you that your life matters. Nobody can question your worth. however it is that you're feeling, whatever it is that you're going through, it's okay and you are loved. Thanks again for watching.